Hi, I'm Jamin, and today I'm going to be talking to you about the alpha-2 adrenergic agonist and mouthful Dexmedetomidine Hydrochloride, or as it goes by its trade name, Precedex. This drug is indicated for use in the ICU for sedation of patients who are going to undergo intubation and mechanical ventilation, or non-intubated patients undergoing surgery. It diminishes the increased blood pressure and heart rate associated with intubation. There's a couple of studies that have been done with it against other sedatives, one lorazepam and the other one midazolam. So the studies show an increased percentage of days at target level sedation with more delirium and coma-free days compared with lorazepam, and the prevalence of delirium was less than with midazolam. Patients on Precedex were significantly more cooperative, better able to communicate pain, and more arousable than those on midazolam. However, decreased blood pressure and bradycardia occurred more frequently with Precedex. As far as administration, this drug is to be given IV only. It needs to be diluted from its concentrate of 200 micrograms per mil down to 4 micrograms per mil. So this can be done at the pharmacy, or this also comes in a pre-diluted solution in very small mils all the way up to the large mils, depending on how long we want the patient sedated for, and that's going to be dictated by the length of the procedure. So the smallest one being 80 micrograms in 20 mils, all the way up to 1,000 micrograms in 250 mils. Like I said, the doctor will pick that depending how long we want the patient sedated for. Because we're looking for a steady level of sedation without hurting the patient, you're going to want to administer this through an IV pump only. And during the administration and after the administration, the nurse is going to monitor vitals, so blood pressure, heart rate, respirations, and O2 sats. We want to make sure we keep the patient stable while they're under. Adverse effects include the cardiac hypertension, the GI nausea, vomiting, and xerostomia, and it can cause anemia and fever. The serious effects are the cardiologic side: atrial fibrillation, bradyarrhythmias, hypotension, tachycardia, and ventricular tachycardia. It can cause respiratory acidosis, hypoxia, pulmonary embolism, and respiratory depression. Because of these effects, and during the procedure, there's probably going to be a physician present or an anesthesiologist, depending on which procedure is going on. There won't be one for an intubation. But the nurse needs to be paying attention to the patient during the procedures, so they can alert the doctor who might not be focused on the vitals and more focused on the procedure he's performing. So this is kind of a one team, one fight scenario where anybody in the room can be paying attention to the patient or the monitors and clue everyone else into what's going on. And that's Precedex. Thank you for listening.